Good evening, Chiamaka. Good evening. Hi, Makwa. You okay? Hola, how you doing? Draw me nearer to thee. Omewoya. Omewoya. Akano omewoya. Omewoya no. Hello, Diamond. What happened? What happened to my song? Oh my God. I don't want internet issue today. So, Jennifer, how you doing? Chibike Frank, join guys. We got a lot to, cover in a short time. Even though I'll try as much as possible to be not so fast, but also not time consuming. Okay. Yes, if I'm a pastor, you know that. Ella, okay. How you doing? Obia Joma, hi. Jenny Blinks, oh my God. Jenny, how are you? Oh my God, I'm happy that you were able to join. Oh, Felix. My song has been interrupted. I don't know why. Thank you, Ella. Ella, thank you. Uzodima, Precious Chantel, how you doing? You okay? Celine, how are you? Juliet Dikocha, good evening. Choma Anebunwa, how are you? Yes, Celine, I'm doing quite alright. Give God the glory. Thank you, Choma. Jenny, I'm so excited to have you here. At least I'm happy to have you here. Ella, I'm very well, thank you. And you? I'm very well, Always shining. Thank you. Thank you, guys. All these I'm interested people should join us. It's not when the time comes, everybody also. Data. Happy Palm Sunday. Thank you. Same to you. Favor, my own sister, how you doing? Happy Palm Sunday as well. Ijoma Igwedi, my personal person, how you doing? Fola, my best student, you're seated with your pen and paper. You know, I haven't seen your other colleague in pen and paper, Parole, Oluebube, Ogoya, Francisca, Maachi, Diamond, I'm very well, thank you, and yourself? So, we will take off shortly. I hope I'm audible. You can hear me very well. Okay. Don't know what happened to my song. Just a chebu. Okay, thank you. Amarachi Francisco. So, Uchechuku Cynthia. I haven't seen you. I haven't read from you in a while. Chima. Where's your partner in mischief, Simon? Okay. So I think we should kick off. Hold on. This my music was abruptly okay. So good evening. Good evening. Yeah, I can hear you. Yeah, thank you. Ijoma, how are you? Are you back from Facebook jail? All right. Okay, so we shall kick off now so that we finish quickly and answer questions. My name, once again, is Dr. Chin Akano. I am the president and founder of Timothy Akano Foundation. I hope you guys are all right and have had a good weekend. I had inspiration to speak to you about ectopic pregnancy, heterotopic pregnancy, and pregnancy of unknown location, so that I can open our eyes to these issues. So we'll start. First, we all know what pregnancy is. So ectopic pregnancy, or ectopic, means in the wrong location. So ectopic pregnancy, normally in a normal pregnancy, after you've had sex, and then the sperm will swim through the vagina, through the cervix, into the womb, and pass through into the tubes. And then if there has been ovulation, that means the ovaries have released egg. Then the sperm would fertilize with the egg. The egg is also known as ovum if it's one, ova if it's more than one. So the sperm would fertilize. Fertilizing means the sperm and the egg will meet together to form a baby. This is what we call fertilization. So that process of meeting of the egg and the sperm to form a baby is what we refer to as fertilization. This happens in your fallopian tube, in the tube. So the female genital anatomy is like this. You have obviously your vagina, you have your cervix, you have your womb, you have your two tubes, and then on top you have your ovaries. Ovaries are the organ that release the hormones and also release your egg and ovary. In that process, we know referred to as ovulation. So when they say a woman is ovulating, it means that the ovaries have released eggs, or ova or ovum. The ovary can release one egg, it can release multiple eggs. So when the ovary releases egg and the sperm comes to meet it there, they form a baby. And this is what we call fertilization. So this fertilization, like I said, if you remember, I said it happens in the tube, fallopian tube. When the baby, that fallopian tube is not equipped to house the baby until the baby is ready for delivery. It doesn't have the muscle, it doesn't have the blood supply, it is not, God didn't make it for that purpose. So what happens is, when the baby is formed in the tube, it stays there for 6 days or between 6 and 10 days, and then it will gradually go down and go into your womb, the uterus, and implants and just attach there. That process is known as implantation. So that implantation will take place in the womb. So the baby will not stay in that womb, and then you have your placenta, which supplies nutrients. Everything is there in the womb for the baby, for you to stay there for 9 months before you have that baby. That is the normal process. But in ectopic pregnancy, instead of the baby that was formed in the tube coming down to the womb to implant, it stays put in the tube. Maybe because there's a problem in the tube, or the tube has a wrong shape, or the tube has got scars, so the baby is not able to go down into the womb. It now stays in the tube. So that pregnancy that does not go into the womb but stays outside the womb is what we refer to as ectopic pregnancy. And I would like you to know that it's not just in the tube that it goes to stay. You can have ectopic pregnancy also in the ovaries, even in your abdominal cavity, even in the cervix. Cervix is the opening into the womb. It can just stay there. It doesn't always happen in the tube. But 95% of all cases of ectopic pregnancy happens in the tube, and is known as tubal pregnancy. Tubal pregnancy. So ectopic pregnancy, in a nutshell, is that pregnancy that is not attached in the uterus, in the womb, where it's meant to stay and develop into a full-blown human being, and then you deliver it, but it's stuck in the tube. And I said why I'm talking about tube is because that's where 95% of this happens. So that is ectopic pregnancy. I mentioned heterotopic pregnancy. I just want to quickly say what it is. Heterotopic pregnancy is like more than one baby that were not formed at the same time or may have been formed at the same time. One is in the womb properly and another is elsewhere, maybe in the tube. So you have one in the tube, you have one in the womb. So that's what we call heterotopic pregnancy. I'm going to talk about the cause as well and how to treat it. Then we also have what we call pregnancy of unknown location. It's like somebody has missed their period, and then you do scan. The baby is not in the womb, is not in the tube, is not in the ovary, is not in the abdomen. You can't find the baby. That's what we call pregnancy of unknown location. It does happen, but it's very rare. Also, heterotopic pregnancy is also rare, but it's commoner in women who have had assisted reproduction like IVF or gift, or women who have had induction of their ovarian induction with things like clomiphene and all that. So that's where you can see it more. Otherwise, it's very rare, heterotopic. Or it's commoner with people who have had assisted reproduction like IVF and gift. So this is what ectopic pregnancy is. 2% of all pregnancies worldwide would be ectopic, 2%. And it's the commonest cause of death in first trimester of pregnancy all over the world, worldwide. Pregnancy is the 40 weeks of pregnancy, you probably know, is divided into 3 trimesters. So your first one, from the day you missed your period to 14 weeks, is called your first trimester. Then from 14 to 28 is your second trimester. Then from 28 to until you have the baby around 42 weeks is the third trimester. So obviously, ectopic pregnancy usually happens in the first trimester. So what happens is that you just miss your period, and within 4 weeks to 12 weeks after you've missed your period, then you may encounter the problem. So usually the problem with ectopic pregnancy happens between 4th week to 12 weeks after you've missed your period, but it's commoner between 6 to 8 weeks. So it's a major cause of death, both generally and in the first trimester when you do the analysis. So that is what ectopic pregnancy means. And then I've described for you how the baby is formed, why it's not in the womb, and where it's located in the tube in 95% of the times, in the ovaries, in the cervix, even in the abdominal cavity. So that's where. And I've explained the reason why this happens, especially the tubal pregnancy. Pregnancy in the tube is tubal pregnancy because maybe there are scars in the tube, or the tube is kinky shape, and so the baby is not able to go down from the tube into the womb. That's how it happens. So the next thing we're going to talk about to discuss who are at risk of having ectopic pregnancy, who is more likely to develop it. Any woman can have this problem, any woman, but there are people who are more at risk. So these are the at-risk group. Number 1, anybody who has had ectopic pregnancy before is more than 10 to 20 times more likely to have it again. Any woman who has had it before is very, very much likely, up to 5 to more than the normal cohort. So if you have had ectopic pregnancy before, your chances of having it again is high. If you have had if you had maybe gonorrhea and chlamydia, and you develop what we call pelvic inflammatory disease, PID, so that can go and cause scarring, like scars when you have wound scarring in your tube, and that can also put you at risk of having ectopic pregnancy. If you also have had a previous operation in your pelvis or your abdomen, then you could also be at high risk of having ectopic pregnancy. If the contraceptive you're using is what you call intrauterine contraceptive device, the coil you put in the womb like copper T, if that's the contraception you're using, if the contraception fails and you become pregnant, you have 20% chance of that pregnancy being ectopic. So that's one of the problems of using the coil. It's not the coil that is causing it, but if, obviously, there is no contraception that is 100% effective. So if you have IUCD and you become pregnant, and chances are that up to 20% chances that pregnancy will be ectopic. If you had an assisted reproduction, like IVF, your risk of having ectopic pregnancy is high as well. If you're a smoker, your risk is also high. So these are some of the risk factors. Another thing I have to mention is increasing maternal age. When you're like over 40, then your chances of having ectopic pregnancy is higher. If you were born with problems with your tubes, then your chances of having ectopic pregnancy is higher. So I've just mentioned to you what puts people at risk. That does not mean that if you don't have these risk factors, you can't have ectopic pregnancy. But if you have the risk factors I mentioned, like previous ectopic, PID, previous operation in your abdomen or your pelvis, or you're a smoker, or you're getting old, 40 and above, or then your risk of having an ectopic is high. Right. So next thing we're going to talk about is symptoms of ectopic pregnancy. How do you know that you have an ectopic pregnancy? Number one, you may have an ectopic pregnancy and you will not just know until things start happening. Like I said, an ectopic pregnancy can actually stay in somebody's tube for between 6 weeks and 16 weeks before it bursts. From 6 weeks to 16 weeks from when you missed your period before it bursts. So if you're a careless person who hasn't, you haven't been to a scan for your dating scan at maybe 12 weeks or 10 weeks, you may just carry ectopic pregnancy and you don't know. But the early warning signs of ectopic pregnancy include sharp lower abdominal pain, usually on one side. It may be on both sides, but usually on one side. Sharp, sudden pain on your lower aspect of your tummy. And then you may have vaginal bleeding. The bleeding is usually not heavy. This is one of the ways we differentiate between ectopic pregnancy and threatened miscarriage, what we used to call threatened abortion in the olden days. Threatened miscarriage. If you're pregnant and then your pregnancy is threatened, you have more bleeding and less pain. This is how we differentiate. With ectopic, you have more pain than bleeding. So these are the early signs. Obviously, if the person has missed their period and now have this sharp pain and then bleeding. So any woman who is sexually active of reproductive age who has missed their period and suddenly have any sharp pain and bleeding, until proven otherwise, that is ectopic pregnancy. Until proven otherwise, that person is down with ectopic pregnancy. So if you are a woman and you're having sex and you have not attained menopause yet, and then you miss your period, even if it's for 2 weeks or 3 weeks, and then you have sharp abdominal pain on one side or both sides, and bleeding, my dear, rush to the hospital because you are most likely having an ectopic pregnancy. So what happens then is that the pregnancy in your tube will grow, and after a while it will outgrow the ability of the tube to contain it, the blood supply and everything. So what will happen is that tube will burst, like balloon will just burst. And then when it bursts, you would start having some other symptoms that would give you an idea that the tubes have burst, or the tube has burst. One of them is blood will pull under what we call diaphragm. Diaphragm is like a muscular thing that separates the abdomen from the chest. So when you have a pool of blood there, the symptom you'll be having is shoulder tip pain. You'll be having pain in your shoulder tip. You'll be wondering, my shoulder is hurting. My shoulder, where did I fall? So that is ectopic that has ruptured. Or you have that urge to go and poo. You want to feel like going to poo. When you go, nothing is coming out. Just know that ectopic may have ruptured. And then when you start bleeding, you start having symptoms. Because what happens is that one of the main problems of this ectopic that makes it very dangerous is that if it ruptures, the bleeding is heavy. You can bleed and bleed until you lose 20% of all your body fluid, and you go into shock. This kind of shock, we call it hypovolemic shock. So you bleed until your heart is no longer able to pump enough fluid and blood for the body, and then your organs will fail. You have multi-organ failure and die. This is what we call hypovolemic shock. You have lost up to 20% of your body fluid from the bleeding. Symptoms would include things like feeling very lightheaded, collapse, shock, So when you're like that, and you have missed your period, you have pain, and then suddenly you're so lightheaded, you're collapsing, the pain is getting worse, just know that ectopic most likely have ruptured and your life is on a thread. You will need to do something. Something would need to be done quickly, otherwise the person could die from this hypovolemic shock. So these are the symptoms. This is how to identify ectopic pregnancy. You lose your period, you miss your period, then abdominal pain, and bleeding, vaginal bleeding, then suddenly shoulder tip pain, urgency to poo without being able to poo anything, and then lightheadedness, worsening abdominal pain, shock, collapsing. You can just collapse. You can just be anywhere and collapse. So that's ruptured ectopic pregnancy, which has led to hypovolemic shock. That's what that shock it is. At that point in time, if they check your pulse, your heart will be racing. If they check your blood pressure, it's so low, things like that, It is life-threatening. That is the reason why anybody that has ectopic, irrespective of their religious faith, must get help. Because there is no... In fact, the chances of an ectopic pregnancy surviving is 1 in 60 million. So 1 in 60 million, you know what that ratio is. So I can say for sure that ectopic pregnancy can never survive. It can never survive. If you want to be the one out of the 60 million with your prayers, good luck. But 1 in 60 million chance of an ectopic pregnancy. There was one that survived sometime in the UK, but that's a miracle. 1 in 60 million, but don't take that chance. So this is the way to identify that you're having ectopic pregnancy and it has ruptured. Okay, so let's progress to how to diagnose how to diagnose for sure that this is ectopic pregnancy. How to be sure that it's ectopic pregnancy. Excuse me. So you have these symptoms that I've mentioned. Obviously, you're going to go and see your doctor. So the first thing, your doctor will ask questions, examine you. Maybe your tummy is so painful and everything. You look pale. If the doctor does a vaginal examination, if he moves your cervix, there's pain on the other side. We call that cervical excitation tenderness. That will be positive. But all that will still not confirm it. So what your doctor will do to confirm it, they will take your blood to check for pregnancy, do a pregnancy test with blood to check for that hormone we call human chorionic gonadotrophin. They will check it to make sure that it's positive, it's high. That's number one. And then you will go for scan. At that early stage of your pregnancy, maybe 6 weeks, 5 weeks, you will have to, the scan you do is what we call transvaginal scan. So this scan now, they will use a different kind of probe, put a condom on it, and put the probe through your vagina to see your womb and see your tubes. It's called transvaginal. So in this type of scan, you will need to wee completely and empty your bladder, because the wee, if there's wee in the bladder, it will affect the rays. So you will do transvaginal scan. So this scan would see the womb, see the cervix, and also see the tubes, and identify ovary, and identify where the pregnancy is. So transvaginal ultrasound scan. But if the pregnancy has progressed a little bit, you can also do transabdominal scan. The normal type you guys do, you go through your abdomen, they put the probe on your abdomen. And that one that you need to you need to drink enough water to push the bladder up so that you can see well. But at the early stages, transvaginal is the way forward. And if you're fat, transabdominal will not work, because the fat will reduce the rays from the probe that they put in your tummy. You know, that probe, that thing they put on your tummy is called probe. So the fat will reduce the rays. That's what we call attenuation. So transvaginal is the way forward, because there's nothing obstructing the rays. You go straight in and you can see. So that's the way to confirm that you have ectopic. In the advanced world, if this ectopic is confirmed, if all these are done and the ectopic was not seen, the doctor will go ahead and do what we call laparoscopy. Laparoscopy is that keyhole surgery. It's like small holes be made around your navel, and some other holes are made downstairs, and then a telescope with a light is put through that hole, and they will look through to see. So that's called laparoscopy. It is also used to diagnose if the scan has not, but the scan usually does. So you will do this laparoscopy if for example the scan didn't find anything, and you'll be thinking, is this pregnancy of unknown location? Pregnancy of unknown location. Nobody knows where it is, so they will do a laparoscopy. So this is how to diagnose ectopic pregnancy. So the next thing we're going to talk about is, we've talked about complications. The complications, obviously, we talked about the hypovolemic shock that can kill you. And secondly, because if your tube has ruptured, that means your fertility would go, your fertility level will reduce. I'm not saying that if you have the ectopic, you can't have babies. You can, but if, for example, you're unlucky, maybe one tube is already bad. Some people's tube is already bad, maybe from infection or whatever, and then the opposite tube is ruptured badly, then you probably won't be able to take in. You probably won't be able to take in again. But if your other tube is fine, or the other, I will explain all that in the treatment. So the main complication is this hypovolemic shock, or when you have blood pooled in your peritoneum, which we refer to as hemoperitoneum, which can cause a lot of problem, as well as infertility. These are the complications. So the next thing we're going to talk about is how do you treat ectopic pregnancy, and how do you treat hypertrophic pregnancy. I will discuss the two of them. With ectopic pregnancy, we have three types of treatment. But let me start with the most definitive treatment. The most definitive treatment is surgery, operation. That's the most definitive treatment. So pay attention. So if we suspect that the ectopic had ruptured a bit, or is big, or they do your HCG. HCG is that human chorionic gonadotrophin level is more than 4,000. Okay, maybe I should just start from the sample and come to surgery. Okay, so we have what we call conservative management. Means no treatment. For your doctor, your obstetrician to decide on this, they would have taken your blood and seen that first and foremost, there's no rupture, you're not bleeding, or the bleeding is mild, and then they've checked the ectopic. The ectopic is less than 3 cm, and they've checked your HCG and is less than 4,000, and then your blood pressure, your pulse rate are all right. So they can do wait and watch. So what they will do is that they will be hoping that the ectopic is absorbed back into the tube, and then you go home and your tube doesn't rupture and you're fine. In some centers, like in King's College London, up to 20% of ectopic pregnancies are treated like this successfully. Nothing, no operation, no tablet, no injection, nothing. They just recover. But how do they do this? They don't just ask you to go home. I don't know whether this is available in Nigeria. They don't ask you to go home. So what they do is that every week, you will come back for this blood test, HCG, come back for the scan, and they will be checking your HCG level and be checking. So when your HCG level has come back to normal, then they will know that treatment has succeeded. Then they can ask you to go home. And they will discharge you. Obviously, they will also explain to you what you need to do if it ruptures. They will tell you the symptoms and the signs and what to do. And in the UK, you will have to live very close to the hospital, not very close, but a reasonable distance, and you have phone if they're going to do this. Conservative management means no injection, no operation, But like I said, remember, for them to consider this, you have to be hemodynamically stable. Hemodynamically stable means your heart rate is fine, your blood pressure is fine, your respiration is fine, your temperature is fine, you're well. So you haven't had a rupture. And then the ectopic from the scan is just 3 cm little, and then the HCG from the blood test is less than 4,000. Then they can decide to do conservative management for you. And then every week, this can go on for like 6 weeks or longer. Every week you come back for a scan and blood test, scan, blood test every week until they will see that the ectopic has degraded and the HCG is gone down to normal. If that fails, they will refer you for surgery. Then there's another, the advantage of this is obviously you're not doing operation, you're not taking medication, your tube has not burst and will not burst. But obviously the disadvantage is that it might just burst while you're at home sleeping. So the next one is medical management, where you're giving an injection intramuscularly through your buttocks, or, the injection is called methotrexate. It's an anti-metabolite. It's one of these very strong toxic medications we use for, strong immunological conditions like rheumatoid arthritis and, so it's a very strong. So you're giving one injection through your buttocks. So the idea is for this toxic medication to stop the growth of the ectopic, and also dry up the one that the ectopic that is already there, and stop the growth. So it is not given before this injection is given. The doctor has to be sure that this is ectopic, because obviously it is a very toxic medication. Even the person that is giving you the injection, if it's a woman, she will be advised that if she wants to be pregnant, or if she's pregnant, she should not give you the injection. So for because of how bad it can affect pregnancy. So that is methotrexate. Sometimes it works, and when they give you that methotrexate, if it doesn't work, you can have a repeat injection after a few weeks to see whether it has shrunk it and HCG is going down. If it doesn't work, the next port of call is operation. So it's in the UK, they don't jump to operate everybody. When I used to think that everybody was operated until when I was doing a master's program in scanning. So I was going to where they call early pregnancy assessment unit, where they see people with ectopic pregnancy and threaten the miscarriage. And I saw how they were being managed with scan and that blood test. So if this fail, the person will go for operation. So I'll discuss the operation for you. So the operation that is done when the bleeding is not heavy, or you're not in severe pain, is laparoscopy. Laparoscopy was the same one I explained to you that you can use to diagnose the condition when the scan fails. So they will use that laparoscope like a telescope, long tube, and put in there and do the operation. There are two types of operation they can do with that laparoscope. One is called salpingotomy. The other one is called salpingectomy. I will explain. Salping means tube. Salping, tube. That tube. Gectomy means cutting. Salpingotomy is like making a hole. So what happens is that when the surgeon goes in and sees that your tube is so bad, he won't have a choice than to cut it off. They cut the tube off with the ectopic. That is called salpingectomy. So they will cut off the tube with the ectopic. But if the surgeon goes in and sees that maybe your right tube is bad, and you only have one good tube, and the rupture wasn't too bad, he can do salpingotomy. So this surgery is trying to remove the ectopic and conserve the tube so that they can use that tube in future to have a baby. I don't know whether that makes sense. Did that make sense? So if the surgeon goes in and your right tube is fine and the left tube is badly damaged, he will just remove the tube and the ectopic. That's salpingectomy, because you can use one tube, because you have two tubes, left and right, so you can use one tube to have your baby. But if one of the tubes are scarred and damaged beyond repair, and then you had the rupture on the other side, the surgeon will try his or her best to remove the ectopic and conserve the tube so that the tube can heal and you can have your baby. You can become pregnant later. That's what I mean. Does it make sense? However, if the bleeding is heavy and you are in a lot of pain, they won't do this laparoscopy. You will now have what we call laparotomy. They will have to open your tummy, like a normal operation, to stop that bleeding, and then because you're bleeding heavily, and this laparoscope is like a tiny hole is made around your bikini, your navel, and another 2 hole down. So he's not going to be able to. They can't use that to stop the bleeding. The person may bleed to death, so they will have to open the person up completely, and stop the bleeding, and then do the operation of salpingotomy or salpingectomy, whatever. So, but that operation is called laparotomy. I hope I'm making sense. Or am I talking to myself? Okay. So that is it. That is how to treat ectopic pregnancy. Conservative, that's wait and watch. Medical with methotrexate, or surgical with laparoscopy or laparotomy. And what they do in there is either salpingectomy or salpingotomy. So let's talk about heterotropic. I mentioned it the other day and people were asking questions. So heterotropic is, one baby in the womb, one baby ectopic. What do you do? Is it, people asked. When you have that kind of, if somebody has that kind of condition, it can be treated. What they do is to do the same laparoscopy and deal with the ectopic and leave the baby in the womb. So after the laparoscopy or laparoscopy, they will remove the ectopic and leave the healthy baby. So the healthy baby that is in the womb can grow and you have your baby. So if you have heterotropic pregnancy, it's not a life sentence as long as the ectopic is gotten rid of through operation. You cannot do methotrexate for a heterotropic one, because obviously methotrexate will kill both the one in the womb and the one in the tube. So you use operation to remove the one in the tube and preserve the one in the womb. Then one more thing is how soon after you had an ectopic can you try for a baby? As long as when you're comfortable, if you had an operation when it's healed, you can, but we advise that people wait for their next period and then they can fire on. Okay? So I think I have been able to cover what ectopic is. Talk about the process of fertilization and implantation and ovulation, and the sites where the ectopics are found. I've explained why it happens. I've explained those who are at risk, more at risk than others. I've explained how to diagnose. I've talked about the symptoms. I've talked about the complications. I've talked about how to treat both ectopic and heterotropic. If somebody has pregnancy of unknown location, and they've done a scan, they've done a laparoscopy, after the scan and they don't find the baby, they look everywhere, just looking for the baby like a missing kitchen knife. They won't see it. Then they will do a laparoscopy and see whether they can find where the baby is. So if they don't find it, then they make a diagnosis of pregnancy of unknown location. But that's not cryptic pregnancy. That's a different thing. So usually they will monitor your symptoms and use conservative management, and at the end of the day, the baby pregnancy, wherever it's hiding, if it's in the eye or in the nose, will disappear. Okay, so let's face the questions that you may have asked, if any. This one is mystic. You once mentioned that 2 babies, one in womb and one in tube, may not be. That's okay. Maybe you asked that before. That's the heterotropic that I just mentioned, Evelyn. Yeah. Laparotomy, yeah. Blessing, what's the full meaning of HCG? I said it is human chorionic gonadotrophin. Human chorionic gonadotrophin. That's HCG. Shara, does it affect us, the men? Is that meant to be a joke? Yeah. So, Gracie Pure, I came late. Yes, you did. Marco, how can somebody detect ectopic pregnancy at home? You cannot detect it at home. You need to go to hospital. We don't know what causes pregnancy of known location. It's just that the pregnancy can't be found. The woman has missed their period, but you can't find the pregnancy. So let me see. So I'm looking for human. No. Ella Bob, you didn't spell it correctly. No, I'm not going to be able to start spelling that thing there. But you got the human, but you didn't get the chorionic, and you didn't get the go. You said HCG. It's not HCK. Gonado. Go. So it's H chorionic go. G. That is the same thing you check for in urine when you do pregnancy test. Looking. Precious one day at home. Is that your question? Where baby find is called what, doctor? I don't understand what Blessing asked me. Crystal Bay, baby without a location. If you don't know where the location is, you just allow it and observe and manage until the HCG goes down. So, yes, thank you, Chima. Whether I'm a medical doctor, no, I'm a herbalist. Rupert King, I'm a herbalist. So where are the questions? Are they hiding? Can a ruptured tube be used again, Evelyn? So that's why I explained it in salpingotomy. Or if the tube is not so bad, they can just remove the ectopic and leave the tube, and it will work again. Yeah. Yes, Marco, I got the spelling now. Human chorionic gonadotropin, yes. What is IVF? This IVF that everybody knows, in vitro fertilization. Women are having IVF every day. IVF is an assisted reproduction. Ugochi Rebulum, did our mothers experience or encounter? They must have, but they will call it maybe Obanje or something, I don't know. Choma, can somebody check if yes, there's a way to check if your tube is patent. Ultrasound, there's one they call hysterosalpingogram, HSG. You know, that would be able to tell you whether your tube is patent. Ugo, Chubemeka, I didn't say there are 3 stages of pregnancy. Pregnancy is normally about 40 to 42 weeks. We do pregnancy in weeks, not in months. So the first 14 weeks of your pregnancy is called first trimester, like first semester in school. While the another 14 weeks is second trimester. Then from 28 to 40 to 42, that you're going to have your baby is called third trimester. It's like trimester, semester, first term, second term, third term. Grace, if how can one know you like you rightly said, you just came now. So I will save the video and then you watch it. I elaborated on that for a long time, so I'm afraid I'm not going to be able to go back to it. Chima, can a man's sperm cause ectopic pregnancy? Ectopic pregnancy has nothing to do with the sperm. It has only to do with the baby that was formed in the tube. No. Evelyn, ruptured womb. Womb is your uterus. The uterus is different from the tube. Uterus is where the baby is housed, while the tube is where the fertilization takes place. It's a different thing. part, I'm talking about ectopic pregnancy. I'm not talking about numbness of people's feet. So another day you can bring those questions. I want to focus on ectopic pregnancy and hypertrophic and pregnancy of unknown location. Thank you. Patricia, obviously I will save the video. Yeah, thank you. All those thousands of people that were shouting interested. I didn't see any of them as well. Hello, yeah. So let me see what Marco is writing. A patient who is gravida 8. Oh, he's gone, he disappeared. Chima, I'm not going to go into the IVF process. I just want to talk about the ectopic pregnancy. Another day we'll talk about IVF. So it looks like no more questions. Doctor, answer my question. Onyi, what question was that? As long as I saw the question and it's relevant to the topic, I would answer. Marco, you missed my question. Is it the very long one? Before I could read it, it would just disappear. It disappears before I can read it. Oh, wow. Can abortion cause ectopic pregnancy? No. Don't worry, Marco, I'm still... Let me see whether I can find it. It's very long. A patient, before I could read it, it disappears. A patient who's gravida 8 presents with missed period for 7 weeks. PV bleeds. Oh, God. Before I could read your long essay, the thing just disappears. Gravida 8 means that the person has been pregnant 8 times, 7 weeks, PV bleeding, cervical. When I save it, I'll look for it. The thing keeps, rolling up. So before I can finish reading and make sense out of it, it's gone. Yes, Ifi, you're right. So people saying I didn't answer their questions. Maybe I'm not saying, good evening, sir, and thanks. I need your contact for personal issue. That's not what we're here for. It's not what we're here for. We found you. Precious one lady, thank you. Thank you. Laparotomy and laparoscopy are 2 treatments. It's not just the 2 of them. I told you medical, I told you about conservative. Yeah, Marco, I saw you. Is Linda and Ijom. I think I saw her briefly and she disappeared. Even Fola. Okay. I've just mentioned Linda's name. I've seen her. Fola of all persons. I think she just disappeared. If there are no more questions, then I'll go and eat my... Go and have my... I'll go and eat my tea. Yeah, I'll go and eat my tea. It's time for me to go and eat my tea. So we'll see whether there are more questions. Upright, why are you answering for Folashade? Are you with her? Thank you, Precious. I've taken notes. Yeah, Upright, it's time for me to eat my tea. It's not, when you say eating tea, Precious is not drinking tea. Eating tea to the British person is eating evening food. Noella, thank you. Thank you too. Yeah. So, it's the time so that I can eat my tea. It's almost 8. Good thing our time has moved forward. So, I'm getting... No, we didn't see all level, but today maybe she didn't have data or she didn't have time. It's not that type of tea. Precious is not that tea. My evening food is tea, so that's why you eat tea. You don't drink tea. I'm eating my tea. Oh, so it looks like the questions there aren't many. So when the questions are not many, it means two things: either people understood the topic, or they didn't. Chima, go and eat your tea, and don't be naughty. Francisca, thank you very much for your gratitude. Blessing, gold. I have sent my question again. So let me keep looking to see whether I can see it. I'm still here. Are they here? Let me see. Ella said, I understood very well. Good student. I like good students, Blessing Oluchi. Yes, so you both they eat tea. Let me go and eat my tea. I am eating my tea. So I don't know what happened to my music. Shit. Wahane, Jesus bunken. Iye soru wahakube. Awani meya. Marapuya. Agamarapu Jesus. Jesus bunken. Do me J, enwere, onye do me J, enwere, onye do me J, onye Jesus ne do monaga, onye do me J, enwere, onye do me J, enwere, onye do me J, nanu Jesus ne do monaga. Yes, I'm in the spirit. Pastor Dr. Chin. It's a long I gotta watch it as on your mogama. I can dance. I got my monsters of the working. Ibuchimo, Bamo, Ibuchimo, Ibuchimo. Ella, if you want to dance, dance. Oh, you're dancing. Good. We gotta be happy, isn't it? Share pastor fit me. You know, if you like saying on the thing that after this time out, I'll just go and open a church and go and. If all staff members are in my church, I go down hammer. I go hammer now. At least that one will be better hammer. You can imagine. Jiggy them, onye nwem Jesus, jiggy them, onye nwem Jesus, nwere muzo. Ọsọ gị kangama, Mary gị kagemeruwa, nye m ike oge niile. Amarida, jiggy them, onye nwem Jesus, jiggy them, jiggy them, onye nwem Jesus, jiggy them. If I ask you to pay offering now, everybody go take off. So you hold your offering, day your day with your offering. Yes, Ugochi, it's not small hammering. Akaya, Akachi over Nemema, Bugaya, Isi can go, Natata, Evo, Akaya. Pastor Chen. Oh, in fact, I don't know. I'm gonna, instead of running a hospital, I just run a church. You want to be rich like me? You can be richer than me. All right, guys, our song has come to an end, and that comes to an end to yet another this session. And I'll come your way again, hopefully next week or the week after, discussing yet another topical issue. All right, guys, thank you for joining in, and God bless you all. Remain blessed, guys. Bye.